The World Health Organization is working with ministries of health from Angola and the Democratic Republic of Congo to vaccinate more than 14 million people against yellow fever in more than 8,000 locations. The yellow fever outbreak has found its way to dense urban areas and hard-to-reach border regions, making planning for the vaccination campaign especially complex. The preventive vaccination campaign aims to build protection in the population perceived to be at high risk of getting infected and prevent potential spread and expansion of the current outbreak. So far, emergency yellow fever vaccination campaigns have reached more than 13 million people in Angola and more than 3 million in the Democratic Republic of Congo. Earlier, I spoke with Tariq Jaservich, Media Relations Officer with the World Health Organization. I asked him just how the WHO was planning to carry out the vaccinations, considering the difficulty accessing the remote border regions and the dense urban areas.
Indeed, as you said, this is a very complex operation, and I will just give you a few figures to illustrate how complex it is. We have to mobilize 41,000 health workers and volunteers to conduct this campaign, aiming to vaccinate 14 million people in just a couple of weeks. We will have 8,000 vaccination sites in Kinshasa, but also in a border area. We needed to bring in 17 million syringes for this operation, and obviously there is a issue of trying to vaccinate people before the rainy season starts. So obviously with the rainfall there will be more mosquitoes, so there will be more of the virus, but also logistically, as you mentioned, it will be more difficult to vaccinate people, especially in the remote areas.
And Tariq, we know that supplies of the vaccine are limited and there is a 6-month minimum manufacturing process. So with this in mind, will you be able to achieve your target of 14 million people before the rains in September?
We hope we will do this, because right now we have enough of vaccines to do this campaign, and the campaign has been planned with the view of what is available in terms of vaccines. What we will be doing, in fact, is that some people will be receiving full dose, but in Kinshasa we will use what we call emergency dose. So it's a 1/5 of a regular dose. We know for sure that this amount of vaccine provides protection for at least 12 months. The idea is being to vaccinate as many people as possible, as fast as possible. So for this reason, WHO is using for the first time this emergency dose that provides protection for 12 months. This is only for children over 2 years old. Those younger than 2 years old will receive the full dose. Even when we complete this campaign of vaccinating 14 million people, as I said, some with a full dose, others with an emergency dose, we will still have some 5 million doses left in our stockpile. It is really important to mention that the production, global production, is limited. About 80 million doses of vaccines are produced annually on a global level. And we work really hard with manufacturers to try to prioritize the production of yellow fever vaccines with the aim really to vaccinate as many people as fast as we can, so we try to contain the outbreak.
Tariq Jaservich, Media Relations Officer with the WHO, World Health Organization, speaking to me a little earlier from Geneva.